Hi, good evening. My name is Maya. How are you doing today? That's good. That's good. I'm going to be your hygienist today. Today, we're going to just talk about, we're going to do an evaluation. We're just going to talk about things we're doing well, maybe things that we could be improving. Does that sound okay to you? Awesome, awesome. Today we're going to be doing a plaque-free score. I know that's fancy terminology, but all that really means is, I'm going to call it a pop quiz, and I'm only calling it that because at the end you're going to get a score. And that's going to help us understand, what we're doing well in terms of brushing, and what we need to improve upon, where we need to improve upon. Okay? So let's talk plaque. How much do you feel like you know about plaque? It's okay, you can be honest. Not too much. Yeah, that's okay, not a problem. All plaque really is just buildup. Bacteria build up on the teeth, food, debris, things like that. And at the end of the day, every morning and every night we want to brush and we want to floss to get all that off so it's not sitting on your teeth and causing problems. Plaque is the stuff that causes like gingivitis, inflammation, cavities, and things like that. Does that make sense? So we spoke about plaque. Now let's talk about calculus. Do you know anything about calculus?
I don't know anything about calculus.
Okay, no worries. So we talked about plaque and how it's built up and it's like bacteria that's sitting on your teeth. It causes a lot of issues. We also talked about how, if you're flossing and brushing, you can usually take care of that and take it off your teeth. But if we're not brushing properly or we're not flossing properly and getting off that plaque, then the plaque can sit there for too long and become hard. At that point, you're no longer able to just brush it off by yourself or floss it off by yourself. That's when we come in so that we can help take it off. Now let's talk about if that plaque stays on your teeth, turns into calculus, and then that calculus stays on your teeth too long. What happens then? So calculus is like very porous. It's like a big sponge for bacteria. So it'll hold on to that bacteria and it will breed the bacteria, which is bad news bears for your mouth because that bacteria causes cavities and inflammation and eventually bone loss, which is something we really want to prevent. Amazing. So tell me about your routine. How are you cleaning your mouth from day to day?
I usually make sure that there's no meat or like food in general stuck between my teeth, and I use flicking / scooping motion for my up and bottom row of my teeth, and then that's pretty much what I do.
Awesome. So it sounds like you got some good technique going on. You're brushing and you're rolling your toothbrush, which is really amazing. Some advanced toothbrushing going on. So tell me about how often are you brushing every day?
Once a day before bed.
Once a day before bed. Wonderful. So, of course, ideally, we want to be brushing twice a day. But the fact that you're brushing at night is wonderful. If you're going to brush at all, it's going to be better to do it at night. That way, you brush everything off of your mouth, no plaque, no bacteria. That way, when you go to sleep, you go to sleep with a clean mouth, which is ideal. So tell me about some barriers. What are some barriers that are preventing you from brushing twice a day?
Or just time management.
Time management. Okay.
For both, flossing and brushing.
Flossing and brushing. Okay. So you told me that you brush more at night. So usually in the morning is when you're skipping the morning brush. Mm-hmm. Is there any way that we can maybe brush at a different time during the day or throughout the day to help get you to twice a day?
By bringing a spare toothbrush to work.
Yeah, that's a wonderful idea. I think that, you can bring a spare toothbrush to work, and then also they make travel-sized toothpastes that you can just easily travel with you. I think that's a wonderful idea. Does that sound like something that you would want to implement into your day-to-day? Wonderful. Tell me what kind of toothbrush that you're using.
It's an Oral-B.
An Oral-B, that's wonderful. It's a name brand, of course, but those brick toothbrushes are definitely much better than the off-brand ones that you buy. A lot of people think that the kind of toothbrush that you buy doesn't really matter, but it definitely makes a difference. So tell me about the toothpaste that you're using.
It's Sensodyne.
Sensodyne. That's wonderful. What made you choose Sensodyne?
I just thought it was probably the best option out of the ones that I've seen.
Yes, absolutely. Sensodyne's definitely got some great stuff in the product. Do you have sensitive teeth?
I don't think so.
Not too much? Okay, that's not an issue. I asked because Sensodyne is, that product is specifically made to help people with sensitive teeth, hence the name Sensodyne, you know. But other than that, it's also got a lot of great properties, like it's got fluoride in it, which will help fight bacteria and keep your mouth clean and keep your teeth strong, which is wonderful. Of course, we're going to do a fluoride treatment for this appointment, and we'll talk more about fluoride then. But yeah, I think Sensodyne's a great option. Let's talk about some techniques. I know that you told me that you like to make sure that there's no food stuck in between your teeth throughout the day, and you like to roll your toothbrush. That's actually amazing. Very, very good. So I want to expand upon that and show you kind of a new addition to your techniques when you're brushing. So what I want you to do is, when you're brushing your teeth, take your toothbrush and angle it towards your gums and just kind of vibrate back and forth. And when I say vibrate, I'm not saying like, you know, very small motions. You want to do very small motions and be very gentle. A lot of people apply too much pressure, which is not great because you can hurt yourself brushing that way. So you want to be very gentle and vibrate in very small motions, back and forth, and then do that for about 10 seconds. And then you want to roll downwards, okay? That'll help stimulate your gingiva, clean the gingival line, okay? And then also that roll helps clean the surface of your teeth, which is really good. And then the same thing on the bottom. When you're brushing, brush towards the gum line, vibrate for about 10 seconds, very gently, and then roll. Now this is the part where a lot of people forget. You also want to brush the inside of your teeth. Okay, same thing, just gently, vibrate, roll, and then that's it. Towards the front, it can get a little tricky just because palates sometimes are a lot more narrow in the front than they are in the back. So what you can do is you can rotate your toothbrush. Instead of having it vertically, instead of having it horizontal, you can put it vertically. And then same thing, vibrate, and just roll like that. So go ahead and give that a try. Wherever you'd like to start, whether it be in the front, the back, or wherever you like. Just make sure you're being very gentle and your movements aren't too big. You want to be very gentle and precise. Perfect. That's perfect. Wonderful. Awesome. Now let's talk about flossing. So you said time management is kind of preventing you from flossing. How often do you say that you floss right now?
Not often enough.
Not often enough. Okay. Well, ideally, we'd like to floss at least once a day, but honestly, floss as often as you can. Having floss, like little travel floss with you, can help just remind you to floss whenever you have the time. Or of course, if there's something stuck in your teeth, you can go ahead and have that floss available to you at any point. But let's talk about technique, right? So a lot of people think that they know how to floss, and this is, no insult to you, but I'm gonna just go over technique so that you can floss most effective, remove as much plaque and as much bacteria as possible, but also making sure that you don't hurt yourself, because that's a really big thing that we want to avoid. We don't want to hurt ourselves when we're flossing. So what I want you to do is take the floss in between your pointer finger and your thumb. Okay, you want to roll it around your middle fingers so that you can have tension. Okay, the tension is what can allow you to have better control. Okay, then you're going to take your pointer finger and your thumb. You're going to grab the floss. That way you have, a little bit of control that way. Okay, you're gonna take the floss, put it in between the teeth, and gently, gently, gently put it in between the teeth. Make a nice C shape, so wrap the floss around the tooth and get under the gingiva, under the gums. A lot of people don't realize how far you can really get under the gums. Now, don't jam it up in there because you will hurt yourself. Be very gentle when you go underneath your gums. But yeah, go ahead and slide it in and out, back and forth, and then out. Okay, then I want you to go back in and do the same thing for the other tooth as well. You want to make sure that you're getting both teeth. Okay, C shape, wrap around, and then go gently under the gums. Okay, so go ahead and give that a try for me. Whoop, here you go. This is for you. Don't put it on that. That's dirty, sorry. Sorry. Move this over some for you. And I can hold this for you, hold it open for you. That looks really good. How did that feel?
It felt good.
Felt good? Was that a little bit more tricky than you maybe guessed it to be?
I just know that it'll probably be more difficult on myself than, on that.
Absolutely. Absolutely. Speaking of doing it on yourself, we will get there. Actually, no, let's go ahead and do it now. So let me go ahead and prepare myself and we'll give it a go. Does that sound good? Okay, wonderful. All right. So we have your toothbrush, we have your floss, and we have a Teppy brush. Let's go ahead and start with the toothbrush. Let me get you a mirror. I'm gonna take that off. Okay. Go ahead and just start wherever you like to. There you go. Angle it towards your gums. Perfect. And then a roll. Perfect. Wonderful. Do you want to try in another area of your mouth, or you think that you've got it?
I think I got it.
Okay, wonderful. Let's move on. Let's move on to the floss. Try not to wrap it around your index fingers. Yeah, you want to wrap it around your middle fingers, definitely. Okay. Perfect. That's perfect. And wrap it. Perfect. Perfect. That's wonderful. Wonderful. You can go ahead and put that down. And also, I forgot to mention, when you do floss, ideally, if you're going to floss daily, you'd want to floss before you brush, just so that you can make sure that in between your teeth is nice and clean. And when you brush afterwards, the fluoride can get to where it needs to be to make those in between spaces nice and strong. High five. Yeah. Okay. So with that out of the way, we can go ahead and get started. I'm gonna set some things up, and then we're gonna go ahead and do that plaque score. Okay, so now that we're all set up, I have my full PPE on. My patient has their napkin and their safety glasses. They've been informed about what we're gonna do. I'm gonna have you do a pre-procedural rinse. And so all that means is I'm just gonna give you a mouth rinse. I want you to swish for as long as you can tolerate it for, and then we'll get started with the plaque-free store, okay? Here you go. I'll take that from you. Thank you. Put some jelly on your lips, okay? This is just gonna help prevent staining on your lips and just hopefully make the experience a little bit more comfortable for you. So what I'm going to be doing is essentially I'm just going to be putting a bunch of purple stuff on your teeth, and where there's plaque or any buildup, we'll be able to see where it is. Okay, and the jelly just helps your lips from getting purple. Okay. Okay, wonderful. So now, to the best of my ability, I'm just going to go ahead and dry off your teeth, okay? So I need you to keep your mouth open for me for this part, okay? Open up and just keep your mouth open. Just open, say ah, yep, yep, perfect. And just keep your mouth open. And turn towards me. Turn towards me. Yeah, perfect. And just keep your mouth open. Okay, and turn towards me a little bit. Perfect. Okay, wonderful, wonderful. We're gonna do the top. I'm sorry, we're almost done. I know it probably doesn't taste the best, but we're almost done, almost done. Okay. Ideally, I would rinse you out, but you got to go to the sink and just go ahead and rinse out your mouth, okay? Okay, now that you're all nice and rinsed, I'm going to go ahead and take a look, and I'm going to mark down where I see some spots that we might be missing when we're brushing, okay? So go ahead and open. Open. Okay. Open. Look towards me. Awesome. Open. Mm-hmm. And look away from me. Good. And look towards me. Look towards me. Okay, now open real big. Good. Alrighty, so now that we've done the plaque-free score and I've recorded everything, go ahead and take a look in your mouth and, you know, notice the areas where you see the pink. You know,
Okay.
you kind of seeing it?
Mm-hmm.
Yeah, that's the areas that you're missing when you brush. Okay, and notice how the front of your teeth and the backs of your teeth are actually really clear, really clear. Where do you kind of see most of the pink stuff in your opinion?
Around the bottom.
Around the bottom, yeah, kind of in between your teeth. Yeah, and yeah, so that's what I want you to notice definitely. And we'll talk about some options on how to correct that and to maybe supplement that. Talk about some things that we can maybe add to your daily routine to help get those spots better. Yeah? Mm-hmm. Okay, wonderful. So what I have here is something called Teppy brush. There's a couple of different kinds. Of course, you could just use regular floss, you know, if that's something that works for you. But I wanted to show you these in particular just because, in my opinion, I think that it makes flossing a little bit easier, a little bit more accessible. A lot of people don't love to wind up the actual string floss and actually use it in between each individual teeth. And so what these products do, it kind of helps eliminate that. Okay. So let me tell you a little bit about it. Up here, I have a little visual aid, and I'll show the camera as well. I have a little visual aid here. And in the first picture, you can see one of the brushes. And you can see how the brush kind of cleans in between the teeth versus a regular string floss. It kind of misses some spots, you know. So the brush, a lot of people like it because it's a little easier to use, but also it gets in between those teeth and into those hard to reach areas. Okay, that doesn't mean the floss is bad. The floss is very, very good. Okay, it'll do a really good job as well. But if that's something that you're interested in, a lot of people like that. And so I have a couple of these for you to take home if that's something that you're interested in. So you can try it for yourself. Definitely, I'm seeing the most buildup in the front. More in the back, you're doing a really good job brushing. Brushing seems to be getting the plaque out of there really well. But in the front, and especially on the bottom, you're going to want to try to get in those spots and clean those out. Okay, and I think that this will be a really good option for you. How does that work for you? What do you think about that?
Sounds good.
Awesome. I also wanted to just show you, I have a little model here. I wanted to show you how to use them just because there can be a little bit of a learning curve with it. The Teppy brushes come in many different sizes. For you, it looks like your teeth are relatively healthy and your gums are, you know, they're not swollen. You know, they're very tight, which is good. Which means I think that you would probably need a smaller size. Okay, they come in a lot of different sizes for a lot of different needs, but I would recommend probably using the pink one. And the pink one is the smallest one. Okay, so all you have to do is take the little top off, you know. And what I want you to do is just go in, just like straight ahead. If you try to go in at an angle, you might hurt yourself. Not great. Okay, so don't force it. If it doesn't fit, then it doesn't fit, okay? We'll go down a size. But yeah, go in at a straight angle. Try to wiggle it in a little bit and just go back and forth and just clean it right in. And that's all it is. Wiggle. Go ahead and give that a try for me. Pretty simple, right? Pretty good. Does that feel good to you?
It does.
Awesome. And then when you're finished with it, what I want you to do is just rinse it off, make sure it's nice and clean, and I want you to put the cap back on. What this is going to do is just make sure that when you're finished using it, it stays clean. Very important, very important. And last thing I want you to practice, I know you practiced on the model, but go ahead and practice your Teppy brush. Nice and gentle. Wonderful. How did that feel, all those things?
Good.
Yeah, did you learn something new today?
Yes.
Wonderful. Okay, well, that's all I have. Do you have any questions for me?
No questions.
Okay. So we'll go ahead and we'll put some fluoride on your teeth. That's just some vitamins. It's just to help your teeth stay nice and strong, okay? Awesome. Alrighty, so same deal. I'm just gonna go ahead and dry your teeth to the best of my ability, okay? And I'm gonna paint on the fluoride, okay? So open real big for me. Thank you, and keep your mouth open for this part, okay? This stuff is nice and sticky, okay? So it's gonna stay on your teeth. I want you to avoid eating and drinking for about 30 minutes. And then after that, you can go ahead and eat and drink normally. Just try to stay away from sticky foods or super crunchy foods. Try not to smoke or drink any alcohol for the next couple of hours. And then at night, when you're ready to brush it all off, you can just brush it right off, okay? Oops, sorry. So one last thing that I wanted to talk with you before I let you go. Let's talk about your plaque-free score. So we talked about what that meant. We put the purple stuff on there, and it told me where you are maybe missing when you're brushing. Okay, and we decided that mostly the plaque is left in between your teeth. Okay, so I counted all the spots where your teeth still had some plaque on it, and the score came out to be about 75. And I know that sounds kind of low because, traditionally 75 is, a C grade, but I wanted to tell you that that's relatively good. Okay, it means that most of the spaces on your teeth are plaque free and you're doing a good job brushing your teeth. Okay, but realistically, I think that you have a really good routine. You're brushing and flossing when you need to. Ideally, we want to maybe try to brush twice a day. And so if you're implementing, maybe bringing a toothbrush with you to travel with you, so you don't have to worry about maybe, squeezing it in and managing your time to brush in the morning. If you're bringing a toothbrush with you and brushing twice a day, prioritizing brushing twice a day, I think we can get that score up to 80 or 85%. Does that sound like a reasonable goal?
It does.
Okay, wonderful. So what I want you to do when the next time I see you, I want you to try to brush twice a day, try to implement the things that we talked about, and let's see if we can get that score up. Okay?
Mm-hmm.
Awesome, wonderful. Thank you.